Good afternoon, Hector. How are you?
Hi,
Can you hear
I'm
me
okay.
okay?
Yeah, I can hear. Can
Okay.
you hear me?
Yes, perfectly. How are you?
I'm okay. Just in bed.
Yeah? You feeling okay or what's going on?
Yeah. You know, I don't know if you know, but 5 months ago I was in accident, in a car
Oh,
accident,
wow.
and I had 4 months in the hospital. So I just got home. Um,
Oh,
yeah, kind of serious injury on my leg. Um, I
sure.
have to use, I have to use my cane now.
Oh, man. So you're in bed.
I'm in bed. I spend
Hmm.
a lot of time in bed.
Hmm.
Yeah. So I watch a
Sorry
lot
to
of
hear
TV.
that. Anything good on the TV?
Just sports. I was watching
Definitely.
the UCLA game yesterday.
I was just going to ask you about March Madness if you're keeping up with all the games since you're in bed watching TV. Of
Yeah, yeah, of course.
course,
Gotta watch
yes.
all that.
I know there was a really awesome game on today, Arizona versus Stanford that I was watching for a little bit. So I'm definitely in it too. So very good. Okay, I want to talk more about your injuries, but let me just go over a couple of quick things and then we'll get started. Okay.
Sounds good.
So, Hector, I just want to thank you so much for filling out the questionnaire and the consent form that I sent over to you. It's really helpful and that'll allow us to get started a little quicker. I just wanted to go over it verbally with you. So let's start with the consent form. So you did give initial electronically and sign. And I just want to go over the statements that you consented to. So the first one is I consent to video, audio recordings being made of counseling sessions and to these recordings being used to aid in the growth of counseling knowledge and skills. I consent to the excerpts from these recordings or descriptions of them being used by the Grand Canyon University faculty and staff for the purposes of supervision, research, and or teaching. I understand that any part of a conversation that is recorded and or written down will be kept confidential. Additionally, throughout the video recording process, the camera will only face the counseling intern so that the client will not be video recorded during the portion of the recorded session. I will not disclose any information that may identify me in the counseling session recordings. I will use an alias. I understand that Zoom will be used to record counseling sessions and that Zoom meets both HIPAA and FERPA confidentiality standards. I understand that the video audio recordings will be kept for a period of 3 months. After the allotted time has passed, the recordings will be deleted by the GCU counseling intern. I understand that if the recording of the counseling session activates, any suicidal ideation or other potentially harmful thoughts, I will reach out to a professional in my area immediately. Neither GCU, the college, nor the counseling student will be held accountable if I harm myself. And just kind of piggybacking off the confidentiality agreement, um, there are some statutes of and limitations of confidentiality if you were to report that there's any imminent risk to or any harm, like you're thinking about harming yourself or others, or there's like a child in danger, then I would have to break the confidentiality and report it. So just to get that clear. Do you have any questions at this time for me?
Not right now.
Okay, excellent. Thank you, Hector. Okay, so let's get started. Um, Prior to us meeting, I did send you over an audit test or a questionnaire with the email with your consent form. So, and you did send it back to me with your answers. So I was just hoping that maybe we could review some of the answers that you gave and kind of go over it, and then we'll kind of get started. So the question that you filled out was called an audit. It's an alcohol use disorders identification test. It's basically like an interview, just to kind of get a grasp of any like problematic behaviors or drinking behaviors patterns that you are experiencing. Um, and one thing I did want to talk about is, um, I wanted to ask you verbally, how often are you drinking right now?
Uh, I drink throughout the day. Um,
Mhm.
I guess since I'm in bed, I don't really have a concept of time right now, so I can't tell you how often or when, but I
Mhm.
have a glass next to my bed just to kind of sip. It kind of helps with the pain.
Yeah, definitely understandable. Okay. Do you find yourself drinking more now that you are in bed now as opposed to before?
I think so, yeah. Probably a little bit more, maybe. But it's yeah, kind
Okay.
of kind of depends on my mood, what I'm drinking.
Can you tell me more about that, about your moods?
Yeah, well, it's kind of stressful right now with so my family's in construction.
Mhm.
I've been doing it since high school. Um, but now that I'm injured, I can't really work. So
Right.
it's hard to see family now because everything reminds me of the job that I can't do anymore,
Mhm.
because of my permanent damage to my hip, and
Mhm.
I can't really lift anything with my arm either. So I
Sure.
probably can't work in construction anymore. So yeah.
And how does that make you feel?
Uh kind of, I don't know. It's hard because I want to make the money in the family.
Mhm.
I'm
Sure.
the breadwinner, so I want to make the money. So I won't let my wife work, you know.
Right.
Um, but yeah, it's hard, I guess.
Yeah, definitely. So what I'm hearing is, after your injury, it's been really hard for your kind of your ego a little bit. You feel kind of guilty for not being able to provide for your family. You kind of feel like that role that you kept for so long is, not there anymore. It's kind of a feeling leaving you to feel a little, you know, negative about yourself a little bit.
Yeah, definitely feel helpless, and
Right.
I don't know what I'm gonna do to make a living now because
Yeah.
this is the only job that I know.
Hmm.
Yeah.
Yeah. Absolutely. Absolutely. That could be very scary.
Especially now. Yeah,
Right.
everything's uncertain.
Sure. Yeah, I'm definitely, I understand what you're saying. It could be very scary during these times because we don't know what's going to happen. Everything's been changing day to day
Mhm.
during this pandemic. And like you said, this was a kind of unexpected. So, along with the accident, it's kind of scary not to know, what's going to happen in the future.
Right. Yeah.
Yeah. So what I'm hearing is that, you're saying, since the accident, you've kind of been in bed resting, and drinking every day to a point where maybe you don't really know what day it is. But what I saw in your questionnaire was a lot of low scores and zeros, kind of minimizing the severity of your drinking pattern. But now talking to you now, I kind of see that that's not necessarily the case.
Mm,
Why do you think that is?
I don't know. I guess I don't see the drinking as a problem.
Mhm.
Yeah. Um, I guess it's a lot of issues
Sure.
just with the family, and then personally, physically.
Mhm.
Yeah. There's a sense of shame too.
Absolutely.
Yeah.
Absolutely. And where do you think that shame is coming from?
Mm, I think it's just all the expectations that I have for myself and from my family, or I feel like my family has for me.
Yeah.
You know?
Yeah.
Yeah.
Okay. So what I'm hearing is that you're feeling kind of ashamed and guilty because you feel like you're not living up to the expectations set forth by your family.
Right. Because I am the oldest son, and I was supposed to take over the business.
Of
So
course.
I don't know if
Sure.
that's possible anymore.
Yeah, I understand. I see. Um, you said that drinking wasn't really the problem. But prior to meeting today for the first time and you filling out this questionnaire, I noticed that some of the problems you were having might be a result of drinking. You had mentioned that your family's not really talking to you right now. You're kind of isolated. But why do you think that is?
Mm, I think it's because when I see them, it just reminds me of all the things that I don't really want to deal with right now, or they're like reminders of everything that I lost.
Yeah.
Yeah.
So I'm hearing is that the you don't see the drinking as a problem because it's that's not really the problem for you because you seem like you're kind of isolating from your family, so you don't have to deal with the way you're feeling.
Yeah. Yeah. I think that's it.
Yeah. How do you think they see it?
I don't know. Like they'll try to reach out, but I keep my room door shut. I don't really engage. I think I just need time.
Yeah,
Yeah.
absolutely. Absolutely. I understand. Um, and can you tell me more about your relationship with your children?
Yeah. They're younger, but they're home now a lot because they're doing the online school.
Sure.
I can't really help them too much with the schooling because they're in the living room. So
Right.
yeah, I really can't play with them either, because I have a limp and this cane. That's kind of,
Mm.
yeah,
Hmm.
hard to do anything
Yeah.
physical.
Yeah. Absolutely. So you're not able to interact with them the way you want to because of the injury.
Right.
Um, and that in turn is putting kind of some distance between you guys. You're not able to participate in their school activities or physically because you're injured.
Yeah.
I see. And how do you think that makes them feel when you have the door closed and you're drinking during the day?
Mm, I'm not sure if they know what's happening behind the closed doors, but you know, um, if they happen to pass by and I hear them, I can shout, and they can hear
Mm.
me. So
Yeah,
I don't know how they feel. I'm sure they miss me.
yeah. And I'm
Yeah.
sure you miss them.
Yeah, I miss them.
Yeah, absolutely. Do you think that if you weren't drinking, that you might be able to participate more in physical therapy and maybe learn how to interact with them or even just being there for them?
Probably, yeah. I could
Yeah,
see drinking a little bit less,
sure.
being more present, maybe.
So drinking doesn't seem to, you're not identifying drinking as a problem. What does your life look like today? Not drinking. What would that look like, you think?
Um, well, it's a holiday weekend, so I think if I was not drinking, I would probably be celebrating with my family or somehow interacting with them instead
Sure.
of in my room with the TV on.
Yeah. So I want to focus on that. Um, Kind of sounds like you kind of can see that maybe there is a little bit of a problem.
Yeah, I think I'm using it as a crutch, maybe
Yeah,
way to deal with the
absolutely.
pain and the stress.
Sure.
Yeah.
So, Hector, you shared a lot with me today. So basically, what I'm hearing is that, unfortunately, you were in this really horrible accident that kind of left you badly injured. And as a result of that, you've been having these feelings of helplessness and kind of feel as if like you're not fulfilling your role and expectations of your family. Um, and that is very painful. you know
Mhm.
and along with the pain of being physically unable to do your duties as the oldest son and the breadwinner of your family. There's a lot of emotional pain there as well. However, though, in speaking with you today, I feel like you might be ready to commit to some changes and maybe talk about some, future goals that you want for you and your family. I can't
Mhm.
imagine that being in isolation is making the injuries or living with this injury any easier.
Yeah. Like I do want to get out
Sure,
and go out.
absolutely.
Yeah.
So would that be a goal for you to do to just be able to get up, maybe out of bed?
Yeah. Yeah, definitely.
Okay. So how do we make that happen?
Well, I guess I have to build up my strength somehow. I don't know how I'm going to do that.
Okay. Okay. So let's make a goal before we meet next week. How do you feel about maybe making a phone call to your doctor, see if maybe you can get on a physical, therapy appointment, and they can maybe at least advise you how to do that first step, so we
Yeah.
can kind of get to an end game goal.
Yeah. I know they kind of set me up, but I was it's just a lot, so I never really followed through.
Absolutely.
But I think
Sure.
I'm open to that now.
Excellent. So does that seem like a pretty attainable goal this week to make that phone call?
Yeah, definitely. Not not too difficult.
Excellent. Okay, Hector. So I have your commitment for your goals, and we're going to keep working on this and get your confidence back. And I'm here for support for you anytime you need. If you need to get a hold of me before next week, feel free, and I'll be more than happy to help you. Before we end our session today, was there anything else you wanted to talk to me about? Any other questions you had?
No, not right now. I think
Okay.
I think I'm set for getting out of this bed.
Yes, absolutely. Maybe enjoy your family for Easter for a little bit, or maybe even have them come in the room with you, spend some time with them, maybe watch the game with
Yeah.
them.
Yeah, maybe I'll start leaving my door a little bit more open.
That sounds great. That's a
Yeah.
great idea. I love that.
Yeah.
Just little steps, little wins, definitely. All right, Hector. Well, thank you so much for meeting with me today, and I will see you next week.
Perfect. Thank you.
Okay,
Nice
bye.
meeting you.